Hello everyone, I'm by the names of Mangen Emmanuel Ouma and I'm a BCN student at the Victoria University, and I'll be presenting to you one of the topics that we cover in oncology, and this is none other than breaking bad news. So by the end of this presentation, one, we shall be able to define bad news, and two, we shall be able to know the importance of effective communication in delivering bad news, and three, we shall look at a protocol called the spikes protocol, which is used by health professionals to effectively deliver bad news compassionately. And here we go. What is bad news? Bad news is simply, or it is defined as, any information that changes a person's perceptions of their future in a negative way. And you know what perceptions are? The way we interpret information given unto us using our senses. Okay, and some of the examples of these bad news are maybe a diagnosis of cancer, HIV positive results, maybe loss of a loved one, maybe to a mother also, to a mother who has been longing to have a child. She is told she has gotten a miscarriage, she will never be happy. That is bad news. Those are some of the examples of bad news. Two, what's the importance of communicating effectively this bad information? When you communicate effectively this bad information, you build trust between you, the nurse, and the patient. And at the end of the day, we will have informed decisions made by the patient. And once all that has been done, this patient will always have good adherence to the medications or to their medications. But if you don't, or if you poorly communicate, this patient will experience, they will go emotional, in that some of them will start crying, they'll become angry, they'll go into denial, depression, and so forth. And at the end of the day, you will have adherence to medication if at all this patient starts treatment. And three, this protocol, the SPIKES protocol I talked about. SPIKES, just an abbreviation of S, standing for, we have SPIKE, whereby the what, whereby the S stands for setting up the interview. And what's the purpose of this? You need to create a conducive environment which is private for you to pass over this, or for the patient to receive this bad news. And you as a nurse, what are you expected to do? You should choose a quiet room. You really need to choose a quiet room which is free from interruptions. You should sit at the same level of the patient, maintaining eye contact. Okay, maintaining eye contacts, minimizing interruptions. If you mean switching off your phones, you need to switch off your phones. Introduce yourself to this client or to this patient. Okay, what is it? Why is it important? A calm environment, we all know that a calm environment helps to reduce anxiety and allow the patient to concentrate on the information that you are giving to him or her. Then step two is assessing the patient's perception. You really need to understand how much or what the patient already knows about this, about the information you want to deliver to them. You can ask them, what do you understand by the tests which were done? Did the doctor tell you about it? What's the benefit of this? It will helps you to understand, it helps you to identify misconceptions that this patient could be having, and also it helps you to determine the patient's level of understanding, and at the end of the day it guides you the amount of information you need to provide to this patient. Then step 3 is obtaining the patient's invitation, and here the purpose is here how much information the patient wishes to know. Okay, you can ask, would you like me to explain the test results now, or tomorrow, or next week, or the other day? Whom would you prefer to be around? Would you prefer your husband to be with you besides you as you bring information? Would you prefer your daughter, or you don't want your daughter? You should always respect the patient's preferences. If he says, "Nah, I don't want the doctor to be, I don't want my husband to be around," please respect what he wishes to. Then K is knowledge and information. Communicate the diagnosis honestly and clearly. Please use a simple language. Don't use medical terms, the so-called jargon words. Okay? Use the language they understand and be clear. Pause frequently, and as you deliver this information gradually. Okay? You pause frequently, as also check understanding, okay, of this client. Then 5 is addressing emotions. Okay, we need to address this patient's emotions with empathy, because these patients experience shock. They start crying, they become angry, they fear, they become, some comes have silence, some go into denial. So as a nurse, you should allow silence. You should listen carefully and acknowledge their feelings. If it means offering a piece of tissue, please offer them so that they can wipe their tears. Okay? If it means providing therapeutic touches or pathetic touch, which is culturally appreciated, well and good. You can say, "Oh, sorry, I can see this is very difficult for you. I understand you're overwhelmed." Have empathy for the patient. Then strategy 6 is step 6 is strategy and summary. What's the purpose of this? Here now you need to develop, now that you delivered the information, the knowledge, you need to develop a care plan, a clear care plan. What next? Summarize the discussion, explain the treatment plans that you have. If it means arranging referrals, please arrange. Okay, ask or encourage questions. If at all they have some questions to ask, please encourage them to ask questions. Okay, and you should also you should schedule the follow-ups appointments. Maybe when are they coming to start the medication, when are they coming to start the chemotherapy, you can arrange with them. Okay, offer psychological support to this client, and patients should know or should live knowing that they are not facing this illness alone. Thank you so much for listening to me. I appreciate it. Thank you so much.